Hello, my name is Anusha Wijeyakumar with Yoga International, and today I am so excited to be interviewing Dr. Sadia Khan, breast oncoplastic surgeon and director of Integrative Breast Oncology at Hoag Hospital in Newport Beach, California. We'll be talking about all things related to breast cancer, integrative medicine, cancer risk, and stress reduction techniques. So stay tuned for more. Welcome, Dr. Khan. We're so excited to have you here today with us at Yoga International. And just a brief introduction to the group. Today, I have with me Dr. Sadia Khan, breast oncoplastic surgeon and director of breast oncology integrative medicine at Hoag Hospital. And I'd love, Dr. Khan, for you to just give a brief introduction to our audience today about the work that you're involved with at Hoag Hospital.
Sure. I'm very excited to be here with you guys today. So my name is Sadia Khan. I am a breast surgeon. For those of you who don't know what that means, I take care of breast cancer patients and also patients that have any sort of breast diseases. So there are non-cancer related breast diseases as well. My role at Hoag Hospital, I was asked to create a breast cancer survivorship program. So anybody with breast cancer is technically a breast cancer survivor from the day they're diagnosed. And we wanted to put something together that was different than what we already had with normal treatment. So most hospitals have really great radiation, chemotherapy, and surgery, just like Hoag Hospital. But we wanted to focus on some of the non-medical issues that affect breast cancer patients and their families. So we put together a great program that, the term integrative medicine essentially means that we're taking some of the non-traditional medical therapies that can complement active treatment, such as wellness, meditation, having a dietitian speak with our patients, psychosocial support with a psychologist, a sex therapist, a fitness coach, and so many other types of integrative therapies to help women along their journeys.
Thank you. And I have obviously the blessing of working with you as part of your program, Dr. Khan, at Hoag. And it's interesting to me because, working in wellness, integrative medicine, holistic wellness are terms that are thrown around quite a bit. And I love how you described the essence of what integrative medicine is. But I'd love you to share with us all what got you into really spearheading this program at Hoag Hospital.
Well, I think for me, I identified a need early on with my own patients. So I really listened to what my patients wanted. And oftentimes, not only were they dealing with their new cancer diagnosis, but they were dealing with stress from going through a divorce or having to be a single mom, or, there's so many variations of what might be stressing certain women out, working full time and trying to manage their families. And so I wanted to develop something that allowed to some sort of extra support system for these women. And, it was various things. I would say it's pretty common that most women with breast cancer don't necessarily know all the different risk factors that are environmental or social or what we do in our everyday lives that affect their risk for breast cancer. So we wanted to help them mitigate their risk. And it really doesn't apply to just breast cancer patients. Breast cancer is very common in women in the United States, and it affects not just our family members, but often people we work with, our friends. And so many people are touched by breast cancer in different ways.
And what would you say the role of stress plays? I know that from research that I've conducted and engaged in an analysis, it was proven that stress in particular plays a direct correlation to the spreading of breast cancer versus, we know that stress plays, a factor in pretty much all disease, but with breast cancer in particular. So I'd love to hear you talk about how you came up with that whole integrative medicine piece for your program at Hoag.
Well, actually, women who are diagnosed with breast cancer, I'm just going to go through a few common things that we maybe don't think about on our everyday lives. But some of the things that we know are risk factors for breast cancer are, number one, stress, how you handle stress. And the reason for that is the stress response in your body directly affects your immune system. So that's why stress is so important. So, speaking to why we work together, Anusha, You were wonderful working with our patients and helping them with stress management and focusing mindfulness and meditation as ways for them to have stress relief, along with some of the other programs that we offer. Some other common risk factors are whether women smoke or were exposed to smoking in the past, alcohol consumption, how much we exercise. That's why it's really important for us to have our patients meet with a fitness coach. What you're eating every day really does affect your immune system and your health of your body. And then also some of the other things like whether we take hormones, other medications that women might be on.
And I know that from working on your program and various other programs at Hoag, it's interesting when I work with our patients one-on-one, because very often, like you've said, breast cancer or cancer itself isn't the main stress in their lives. It's, like you've mentioned, divorce, interpersonal relationships, work, family. So there's a number of other contributing factors, i.e. life, that contribute to cancer in general and risk of cancer and breast cancer. And I think that it's so important, the work that you're spearheading at Hoag Hospital, to actually offer integrative medicine and holistic wellness to your patients, like you've said, with me, with the meditation and mindfulness, but also with our dietitian focused on nutrition and our fitness coach, which is focused on exercise. And so what would you say the impact has been to your patients from this whole new program that you've launched at Hoag?
So we started the program probably about 2 years ago. So we're into our second year, and we've had a wonderful response from our patients. The important thing is, as a doctor or as a surgeon or as a physician, is we don't want to just focus on one disease. We want to focus on treating our whole patient. So that means all the different psychosocial parts that go along with developing cancer, going through treatment, how it affects the patient, their family members, their friends, their coworkers, their job, how it relates to what they're doing in their everyday lives. And we really want to focus, and why we put this together is to help them get back to a new normal where they're healthier maybe than they were before, and they focus on some of these risk reduction techniques. And it's important for them also to spread the information to their daughters, their cousins, their sisters, so it affects less patients. I think the work that we're doing is wonderful. We've gotten a great feedback as far as from patients doing, we've done individual studies where we ask women to participate in complementary wellness services in exchange for some feedback. And 100% across the board, every woman was so thankful for getting services that included mindfulness and meditation for stress relief, oncology, massage, a fitness specialist, sometimes a sex therapist. So different various providers that are in the wellness world were offered to these patients alongside of their normal treatment. So instead of having to maybe go through their cancer diagnosis on to surgery, radiation, and chemo without any additional support, we're able to support them in different ways that affect their lives. So we did have an overwhelming response to the actual services, but we also do additional things like offer out support groups. We've been doing these wonderful empowerment series where we feature different speakers, and it really is relatable to women who have gone through breast cancer, but also to women who they want to bring with them, like their breast friend, their family members, or their support person.
And there's a couple of things that I'd really like to touch upon. The first is, you mentioned sex therapy. Now, we know why, working together at Hoag Hospital, but for our audience, they perhaps could be thinking right now, what is the purpose of having a breast cancer patient meet with a sex therapist? So I'd love you to give your thoughts on that, Dr. Khan, and the reason behind why it's so important.
Well, for most people that go through breast cancer, there's going to be a distinct change in the way their body looks after they've undergone surgery. And that can be true for small surgeries or patients that have more aggressive disease and need a more extensive reconstruction. So part of why we think it's important to meet with a sex therapist is for women who are going through these changes to understand why and how their body is going to change, and that they can feel normal knowing that some of the insecurities they feel or may not feel are normal and are a normal part of that healing process. We've had women who undergo radiation, surgery, and are going through chemo, so changes like losing their hair, and they really do feel a loss of femininity with breast cancer surgery. So we think it's very important to support our patients and help them through that journey and get them back to where they feel good about themselves and they're comfortable in their own skin.
And I think that's such a pivotal part of what you're doing at Hoag, because we know that body image is something that affects a lot of women, where they often tend to feed into that internal negative narrative. And I guess the wonderful thing about yoga and meditation and mindfulness is that we are able to work on changing that habitual negative narrative alongside the work of the sex therapist with our patients. Because, like you've said, it's like, not only is it life-changing for the fact that you become a cancer survivor, but it's life-changing from the fact that you look completely different.
Yeah.
And it may not be that your hair returns to the way that it was, or your body returns to the way that it was. So I'd love you to kind of give us some education now on just cancer risk reduction and the importance of integrative medicine for all of us, whether we've had cancer or not.
Definitely. I think one common thing that probably most people may not know is that breast cancer is very common in the United States. 1 in 8 women will develop breast cancer in their lifetime. And if you really think about that, if you're in a room full of 8 women, somebody in that room will be touched with breast cancer. 12% is what that rate is in the United States. So 12% is the average risk person walking around without family history, without any other risk factors. Some of the common risk factors that are environmental that you can affect is things that you're doing to your body for health. So I touched upon some of these, but I'll be a little bit more detailed. So smoking is a big risk factor for breast cancer and pretty much almost every cancer and other significant diseases like cardiovascular disease. So it's very important that if you're smoking, to try to minimize how much you're exposing yourself and hopefully one day quit. Alcohol intake is another thing that I think most people probably don't know about or associate with breast cancer, but alcohol intake is associated with the risk of breast cancer. So the recommended amount of alcohol is less than 1 drink a day, or to minimize from that. Also, what you eat plays a role. So we recommend dark leafy greens and more cruciferous veggies. Things that are considered antioxidants are going to help your immune system. So those things should be helping with cancer risk reduction. Exercising, it's recommended that women perform 120 minutes of exercise a week. So if you can do 3 brisk walks for 50 minutes each, pretty much you'll meet that requirement. So 150 minutes was that number. I think I said 120. So 150 minutes of moderate to brisk exercise. I just recommend to my patients, you don't need a fancy gym membership. You don't need to go out and buy the Peloton. You can just walk. So as long as you're walking enough that if you were with a friend, it'd be hard to speak normally. That should be fast enough. And then making sure your weight is in what's normal for the BMI or body mass index, because obesity is a risk factor for breast cancer. So those are some of the 5 things that probably you could do to affect your risk. Some other common misconceptions might be vitamin D deficiency is linked with breast cancer. So we want to make sure everybody is going out and getting sunlight, making sure that you're staying healthy or taking the supplements if needed. There's lots of studies on turmeric being anti-inflammatory for the body. So those are some other tips that you can hold on to help reduce your risk for breast cancer.
And would you say, Dr. Khan, that you've seen with your patients specifically that meditation and mindfulness can really help them through radiation and chemotherapy? So it's not just the diagnosis, but through the actual, pre and post treatment.
Yeah, we've had a great response to mindfulness and meditation. We really try to keep track of what topics are interesting for our patients. So we do surveys before events, after events, and we've had a great number of women that maybe didn't know much about mindfulness and meditation before our program started, but now it's become like a buzzword, really, I think, online and social media. And I think it's helping our patients in ways that we maybe didn't think of. So, the stress of getting a cancer diagnosis is unimaginable, along with having to be working and taking care of a family. So, I think a lot of women are constantly wearing the mom, the working hat, but they aren't necessarily taking care of themselves. So I think mindfulness and meditation in our breast cancer patients has helped them really process through the diagnosis, help them to maintain some amount of normalcy, maybe taking time for themselves throughout that day. I know, Anusha, you love talking about the 5-minute meditation. And I think a lot of our patients can prescribe to that because it's not taking hours out of their day. It helps them to kind of process what they're going through. And we've had wonderful feedback on your program and some of the tips that you've given them so that they can use this as a source to get through kind of what they're going through with their active treatment.
Right. And we know that I'm the firm proponent of we've all got 5 minutes.
Exactly.
Because we do, we really do. We make the time to do the things that we want to do, but sometimes, especially as women, and especially if we're mothers or we're caring for elders or we have a busy work life, whatever it is, it can sometimes be difficult for women to focus on making that time for self-care. So I love the role that integrative medicine plays in your breast cancer survivorship program, because quite frankly, we know that it works. And we know that sometimes as women, we need to be told to take the time, versus actually prioritizing sometimes our own needs. Because, for myself anyway, as a working mother, I'm always prioritizing the needs of my family and everybody else before myself. But if there's one thing that I do daily, it's meditate. And I think, what I say to all of our patients and clients, meditation works if you do it. It's not going to work if you do it once a month or once every 6 months or once a year. But if it's something that you can build into the fabric of your day, you will absolutely see the benefits to that. And now also I'd love to, because you mentioned how with the breast cancer survivorship events that you have, there are people, and I know that we've had people come that don't have cancer and have found it really useful. So could you talk to us about how you come up, Dr. Khan, with the programming outline for these events that you have at Hoag?
Well, we try to think of different platforms where we can affect patients that are outside of just of our normal clinic day. So the Empowerment Series was really probably a great innovation because we invite women and their family members and their friends and their support staff to come in for events that we hope that they will find useful. So we try to vary our topics and our speakers to really touch upon different parts of wellness and integrative medicine. Some example speakers that we've had in the past are obviously, Anusha, you've been a speaker for mindfulness and meditation, but we've also asked you to do some talks about stress reduction, which is a really key part for breast cancer risk reduction. We've had our, different physician support staff that work in the program, such as a radiation oncologist, a radiologist, talk about the different medical aspects of breast cancer, but we really love featuring our wellness providers. So we do have a registered dietitian that comes and does talks. We've talked about carcinogenesis in different types of food or cancer prevention foods. We have a fitness coach that's led a small fitness demonstration. We have our lymphedema specialist talk to women. So there's various types of providers that we've offered out. And you are correct. We've actually had so many women who may have had ovarian cancer, other types of female cancers. We've even had people who have chronic back pain, and they've heard about our events from their friends or their family members, and they find the topics to be useful. So I think the important thing about developing a program like this is the goal of integrative medicine is it's supposed to be complementary to normal traditional medical therapy. And we want to focus on what we find interesting, what our patients find interesting. And I think that feedback from the patients is really what's driven the program. And we try to put together events, throughout the year that also allows bonding and partnership between all the different patients and their providers.
Which I think is such an important part of survivorship, where people that have had any cancer, but specifically breast cancer, can come together and can come together in community to have that shared experience. And I know that one of the events that I spoke at last year, I had one of my dear friends, Penyon, come from London just because she was present. Now, she's not had cancer, nor has she had anybody in her family have breast cancer, but she found it incredibly informative and very useful because there were certain talking points that were relevant, whether you've had cancer or whether you haven't. And I'd love you to debunk a very common myth now that I know from the events that I've spoken at with you, people go crazy for this, is soy. And how much soy should we be having? And does the intake of soy or processed food, specifically soy, contribute to increased cancer risk or recurrence of cancer?
So that's a great question. We do get asked that all the time. So the reason soy is even up for debate is that there is, so we know that hormones do affect our breast cancer risk, as we discussed kind of earlier on. Common receptors that are sensitive, in our breast cancers that we hear about are estrogen and progesterone, which are naturally occurring hormones in our body. So we know that hormones don't cause cancer, but the excess or different responses of the hormones can affect our current breast cancer that we already have in our body that we may not know about. So the reason soy is up for debate is there are some plant-like estrogens associated with soy products. There are many studies on soy consumed as a dietary product in different ways. And I think it's very common for women to assume that they are not allowed to have any soy products when they have been diagnosed with breast cancer, or if they want to mitigate or reduce their risk of breast cancer. The straightforward answer is you can find pretty much any scientific study you want that can prove either way of the argument. But the important thing is the really good medical sound research has not proven that soy products can increase your risk of breast cancer. So the most important concept, I think, would be just having everything in moderation. We know that the amount of soy that's needed to cause any sort of risk is not physically possible in the traditional American or Asian American diets that are here in the United States. So you're pretty safe if you're just going to have some edamame or have your soy with your pad thai.
Okay. Well, that's good to know. And I think a lot of people may or may not be aware of that. And I'd like you also now to talk about male breast cancer, because that's a topic I know that sometimes people aren't even aware that men can get breast cancer.
You are correct. 1% of breast cancer does occur in males. It's not something most people think about, but male breast cancer does happen. The most common reason why men find their breast cancer is that they feel a lump in their chest or their breast. It's very similar to traditional female breast cancer because it is developed in the breast tissue. The biggest difference is that male breast cancer oftentimes, because it's so rare, can point to a hereditary reason for breast cancer or some sort of gene that follows that person and their particular gene line. So maybe some of their children or their relatives that may have put them at a higher risk for developing breast cancer. I've also had quite a bit of male patients that were taking steroids or exogenous hormones for bodybuilding that then develop breast cancer. And we know that those are risk factors.
Right. Well, thank you for that education, because I do think that's an important part of the conversation. And you did a great segue already, but one of the questions that I wanted to ask you was about the high risk factor if your family members have suffered from breast cancer. So can you talk to us about breast cancer in terms of genetic mutations and family history?
Yes. So maybe this isn't so common, but I would say the traditional thinking is that breast cancer really happens to people where it runs in their family. But as we discussed earlier in the segment, 1 in 8 women develop breast cancer who have no risk factors. That is the general risk. When you do have multiple relatives with breast or ovarian cancer, that combination may tell us that there might be a particular gene that runs in your family that puts you at a higher risk. The The general rule, though, is about 75 to 70% of breast cancer has nothing to do with your genetics. It's more related to those environmental factors that we talked about that put you at risk for breast cancer. So it's not common to have hereditary breast cancer run in your family, but if you do have multiple relatives with breast or ovarian cancer, make sure you talk to your doctor about the options for genetic testing.
Thank you, because again, this is something that some of our audience members may not be familiar with, just in terms of that high risk family members. And it's always important, I always believe that with more education, we can have greater awareness of any issue. And I know, Dr. Khan, about all the amazing work that you're doing, but I'd love you to share with the group your passion as to why you chose to become a breast surgeon.
Well, I think that surgery is a very unique field where you can, as a physician, touch and change lives every day. Many things that we do in surgery are life threatening. Cancer, obviously, is one of those types of diseases, and it's very rewarding to be able to identify women, meet with them, meet their family members, create a bond, and help them go through their journeys and hopefully come out with a positive result. So that's very rewarding, I think, to be in a field where the majority of women do really well and as long as they're treated early, can be cured of their breast cancer. So that's what motivates me, is seeing our patients go through these journeys and end up obviously having a wonderful result. That isn't always the case, but for the most part, if breast cancer can be detected early, women traditionally do really well. So it's really imperative for women to have mammograms. The recommendations are still that you should do yearly mammograms if you want to minimize your risk. I know some conflicting evidence is out there about every 2-year mammograms, but cancer doesn't wait. So if you can do your mammograms every year, it's just one time a year usually. It's a quick in and out, and it can save your life.
And what about, Dr. Khan, just self-checking? Because I know I've heard mixed, feedback. Before it was do your daily check, and now that's not as important. Can you share your perspective on that? Like what we can do as women and men at home to check ourselves?
So that's a great question. There is contradicting recommendations about whether women or men should be doing self-breast exams. I think the issues are most women have lumpy, bumpy breasts. Let's just be honest, okay? We feel around and we're like, well, I feel some lumps. Is this normal? Is that normal? And it's hard to know. So the key part that I like to tell my patients is the most important reason for those self-breast exams are that you yourself probably know your body the best. So if you notice a distinct change in your exam from 1 month to the other, or even if you don't do it every month, but you noticed a huge change in your breast from 1 month to 6 months later, that you let somebody know so that we can double check. Oftentimes, breast cancer is not always going to be something that a patient feels. So if you do feel something in your breast, typically we're looking for a really hard, large mass, like a marble or a golf ball. It's not going to be kind of the small lumpy bumpies that everybody has in their breasts. So I don't know that I would say that everybody has to do every single month a breast exam, but I don't think it's a bad thing if you kind of understand what's normal for you. And every once in a while, every couple months, maybe you're checking to make sure everything feels normal. And it's not just lumps that people should be looking for. Nipple discharge can be abnormal and might be an indicator for breast cancer. A skin dimpling or a change in your skin that you didn't have before could indicate breast cancer, or a lump underneath that you may not feel, or even redness of the skin that doesn't go away, or changes in the way the nipple looks. So anything that's distinct in you, you should let your doctor know.
That's very helpful, Dr. Khan, because basically it's anything that's abnormal. And oftentimes it could be that we might brush it away, we might not think anything of it. But I think what you're encouraging everybody to do is, if anything is abnormal, to go and see your primary care physician and then get a referral, which I think is just important in general, cancer related or not. But I have a question now about the mammograms. What is the age now that it's recommended to actually get your annual mammogram?
So that is a good question. Unfortunately, it's not a straightforward answer. I will tell you that the radiology and the breast surgery societies do recommend that 40 is still the general age of starting mammograms. We know that women can develop breast cancer at a younger age. So just because the recommendation is to start a mammogram at 40 doesn't mean that somebody in their 20s and 30s cannot develop breast cancer. So 40 is a good average age. But obviously, if you have any changes in your breast, or maybe you are one of those people who have multiple relatives with breast and ovarian cancer, you might have a younger age of recommendation. But the general person with no risk factors, we would recommend at age 40, do a baseline mammogram and consider doing it every single year going forward.
Thank you so much, Dr. Khan. I think what certainly I've been re-inspired with is breast cancer in particular, how important the role of integrative medicine and holistic wellness is in terms of those risk-reducing factors. And that every single one of us have learned something from you today about tools that we can implement about stress reduction, as we know that there is that direct correlation between stress and an increased risk of breast cancer. So thank you so much, Dr. Khan, for joining us today at Yoga International.
Thank you so much for having me here. It was really wonderful.
Hey everybody, it's Jim from Yoga International. Thanks again for watching this episode of Finding Balance here on YouTube. Really appreciate you joining us. If you like what you learned today, you can find more information with the link in the description. Also, don't forget to subscribe and hit the like button for our series so you don't ever miss an episode. Again, you can find more information in the description, and we hope to see you soon. Please stay well.